I would like to introduce our first presenter for today. Our first presenter for today is Mr. Rapheal K. Falegbe, a member of the Orapu College of Scholars. Rapheal K. Falegbe is a certified dental technologist with a postgraduate diploma in epidemiology. He is presently working with Dental Design Laboratory. He will be presenting on the topic measuring oral health. Sir, if you can hear me, the floor is open. You can go ahead and make your presentation. Admin, please unmute him so that he will go ahead. Thank you.
Good morning, everyone. Good morning, everyone. My name is. Good morning, everyone. My name is Rapheal K. Falegbe. This morning I'll be talking about representing on measuring health. Firstly, we have to look at our outline, which is the table of contents. Firstly, we have the introduction. We'll talk about the introduction. I'll give an introduction to the paper and the characteristics of earth measuring instrument, because definitely there is always an indicator for measuring earth. So we'll be talking briefly on that. We'll also talk about the need for measuring earth using these indicators. Measuring earth in clinical settings will also be looked into, and measuring earth in human population. Then conclusion and reference. The introduction. The possibility of earth is an harmony between an individual and its environment as a basis of well-being. Basically, this basically looks at your relationship as an individual, as a human being with your environment, showing that your environment play a vital role in towards your health. The advancement and comprehension of Earth become official when the World Health Organization introduced the definition, the identity of Earth, which is basically defined as the state of complete social, physical, mental, and psychological well-being of every individual, not merely in the absence of disease or infirmity. The World Health Organization explained the conceptualized well-being as a human right. Well-being is basically talking about you as an individual having the feeling of being healthy. Now they now conceptualize it as the human right, which means that every individual, you and I, are entitled to have a standard of living. Now, this shows that in the absence of diseases, let's say when an individual comes in contact with infectious agents like the bacteria, the fungi, the prions, the viruses, they become infected, which will basically lead to disease. And this infectious agent can be transmitted either by airborne, either by contact with contaminated surfaces, either by contact with infected person, either by blood. Now, this Earth basically it's measured and it's looked into by the use of some certain measuring instruments, and these measuring instruments basically monitor and measure the health status of an individual. The health status of an individual, they measure, they look at they look at they measure and monitor the health status of an individual. They looks at the health conditions that requires attention, that requires examination or promotion exercise. Basically, we will look at the characteristics of this measuring instrument. Firstly, before you as an individual, or before you as a professional um, uses an measuring indicator. Firstly, these measuring indicators must possess this quality, these characteristics. A measuring indicator should be valid. Valid in what sense? A measuring indicator should be able to measure what is expected to measure. Let's say you are supposed to measure a particular disease condition in, in a clinic or in a human population. Then it's supposed to measure the exact purpose it's supposed to measure. It should be reliable. Let's say um, you are to use this indicator by two different individuals or by two different enumerators to measure Earth in different perspectives, in different areas. Let's say this measuring indicator should be able to give similar results. That is, what I will produce from using this indicator should be similar to what the next individual will produce in using the same indicator. Now, it should be relevant. It should be relevant, that is, it should be able to contribute to the understanding of the situation. Let's say it should be very, very important when we use it, that is, we can easily, we can easily fall back on. And then it should be feasible. Basically, it should be accessible, and it should be able to obtain the required data we are expected for it to obtain, to get. And then lastly, it should be specific. It should clearly define what with clarity. It should define the condition or the situation on ground with clarity. Nextly, we have to move to the need for measuring Earth instrument. Now, several authors and institutions have proposed as an institution regarding the use of Earth measuring indicators. Basically, we'll be talking about descriptions, prognosis, advocacy, evaluation, and research. Firstly, I will look at description. Now, this measuring Earth indicators, as a professional, this measuring Earth indicators would basically describe a situation. In what sense? It describes, let me say, for instance, there is a particular disease condition in a particular locality. Now, what this Earth indicators do is that it helps you to describe the situation. It helps you look into the situation. It helps you focus on the area you're expected to focus on. Let's say there's a particular, let me say there's an outbreak of, let's say there's an outbreak of cholera somewhere, and this indicator will help you to discover those that are infected, like those who is infected at that particular time period in that particular period of the outbreak or the particular condition. It helps you explain when are they infected and the look and the area where they are infected. Who is infected could be the age. They could be different in individuals, like infants. Could be talking of adults, or talking of elderly individual, and then it's also explain when they are infected. Could be during the rainy season. Could be. So this indicator talks more about this situation and where are they infected, the locations where they are infected, and it also help you to acts as a prognosis, like it forecasts every possible it forecasts it forecasts any possible influence, or let's say a kind of any possible form of disease outbreak. It forecasts if there's going to be a kind of a disease outbreak subsequently, and also help to prevent any form of epidemics. It also look at it advocate. It serves as a tool of ideology to support ideologies like cultural ideas, like historical ideas. It also serves purpose. It also helps as to evaluate. It investigates the impact of health policies. Let's say there's after a lot of research has been carried out, it looks into advocating, stand for. It it evaluates the impact of those policies on the condition or the situation on ground. And it also serve as an indicators for research. Let's say it talks about research basically has to do with say a systematic investigation that discover an established fact or develop hypothesis. So what this does is that it helps you to propose a kind of, let's say you discover a condition, this particular indicators help you to explain and propose an explanation towards the particular condition. Nextly, we'll be talking about the next slide, please. We'll be talking about the measuring instrument basically in clinical settings. Basically, in clinical settings, we have two major types of measuring indicators. There are two basic measuring systems in clinics for measuring health status of an individual. There are two major. Basically, we have the subjective measurement of health and the objective measurement of health. The subjective measurement of health, it's based on explicit criteria that make use of some measuring instruments to form a quantifiable data. Now, it is good to note that these measuring instruments are impartial. This measuring instrument does not require the opinion of the observer. You and I, we are the observer. Does not require our opinion to give us an accurate result. Now, this measuring instrument does not require our input. So this measuring instrument, like I have stated on the slide, like example like the thermometers, the electrocardiograph, the ECGs, the fluidometer, the cholesterol and blood glucose monitor. And another area again which we also take into consideration is the subjective measurement of health. Basically, many of us might not really know what this is all about, but subjective measurement of health basically looks at self-reports. Like you and I who are clinicians. Let's say a patient comes to your clinic and then you want to examine the patient. Instead, you don't. What you do is you explain. Like it's a kind of interaction. You're asking the patient, "How do you feel? How do you feel about your health?" Now, this does not require the involvement of tools or instruments this time. Now, it now requires you as an individual to communicate with your patient. Let's say your patient is having arthritis, and the patient comes to you. You want to measure the health of the patient. What you do is you ask the question to the patient: How do you feel about your health? How do you feel? How many steps are you able to make before the pain results? Now, this is a kind of measurement that requires interaction, interview, observation. Now, the most subjective measurement of subjective measurement of health requires of health status using subjective method is a perceived health. Now, what I mean by perceived health is let's say the subjective measurement of health is applicable both in the clinic and also outside the clinic. That is, in the clinic as a clinician, you give the patient a form of questionnaire, and the patient fill the questionnaire to express himself or herself about his or her own health. How do you feel about your health? Let's say how do you feel about your health? You give them the questionnaire and they feel good, and my health is good, very good, or excellent. So this is another way of measuring the health of an individual in the clinic. Secondly, we'll go to the next slide, where we talk about measuring health in human population. There are several measuring indicators used in measuring health in human population. Basically, I listed some. There are so many indicators, but I just out of because I will be able to meet up with time, I also have to bring out some out. The morbidity indicators, the mortality indicators, the indicators for behavioral risk factors, the health service indicators, and environmental indicators. Firstly, we will look at the morbidity indicators. Morbidity specifically has to do with measuring the occurrence of disease. Basically, it could be injury, diseases among disabilities among human population. What this measuring indicators does is that it measures the prevalence and incidence rate. It measures the attendance rate of outpatients, the number of patients that comes into the clinic or your hospital. Then it also measures admission, readmission, and discharge rates. It also measures the duration of stay of patients in a hospital or a clinic. We also look at the mortality indicators. The mortality indicators measures the death rates of a population, either in a country, in a community. It basically look at maternal mortality rate. Maternal mortality rate basically look at the number of mothers who died as a result of complications. Complications like let's say excessive bleeding during childbirth, like infections after childbirth, like the high blood pressure, um, basically known as a preeclampsia, with like the useful abortion, like this frequent form of child elimination from the belly. So we this also look at the child rate and the infant mortality, which is the next measurement. It looks at the number of infants who died every for the number of infants who dies for every 1,000 live births. It's also determined that child who died as a result of let's say birth defects or injuries or suffocations, and so many reasons that could result to that condition. We also look at case specific mortality. Specific mortality basically look at the number of deaths from stated cases in per year to the numbers of the population in a specific age range or age group among the human population. Then we also look at the proportion mortality. Proportion mortality is basically look at the proportion of death of an in a specific population over a period of time attributed to different cases. Nextly, we will look at the indicators for risk behavior. The indicators for risk behavior, it is good to note that change in demographic profile of a population has led to drastic increase in non-communicable disease that cannot be transmitted from one person to another, like the heart disease, like diabetes, like lungs disease. Now, this indicator looks or measure the prevalence of smokers. You can see today in our own world, in our own country, in your country, in my country, we have the amount of smokers keep increasing. Now, this indicator measures the amount of smokers, regardless of the number at which the number of sticks they smoke, or the number or the frequency of smokes they engaged in. So this indicator also looks at the excessive alcohol consumption among individuals, and also look at unhealthy diet and what we consume. How does this cause results to death? How does it affect our life? How does it affect our well-being? So this indicator also measure this these factors. I will also look at the health service indicators. The health service indicators um, talks about the it's focused on our hospital system, our health service system. Now, health service as today has faced of challenges like in my own in the country where I reside, a lot of challenges like challenge with rise in cost of treatment and expenditure. And one thing we all know is that minimum workforce. It is expected that the World Health Organization proposed that for every centers for a doctor or for a practitioner to attend to patients, it is required that one doctors to 600 patients. But nowadays we realize that these things are not like that anymore. What we see now is that one patient attend to 2,000 people. One patient, one clinician attend to 2,000 people, 3,000 people, 4,000 people. So this is really affecting the health system in our country today. Now, this indicator basically measure the doctors population ratio, which I've just made mention of. It measures the doctor population ratio. It measures the doctor to nurse ratio. How many doctors and nurses are present in your facility? How many? How many? How it also measures the population of beds. You realize in some clinics, when you visit some clinics, you realize that the number of beds uh, present in that facility is minimal to the number of people that you found in that particular center. That also measures that purpose. Also measures the number of health sub centers and then how the number of centers in your community. How do this center meet up to the expectation of the population? How do they meet up the to the health need in the community? It also looks at the number of traditional birth attendants. Same thing in the hospital or in the community, and also determine the cesarean the population of cesarean sections carried out in the hospital or in the clinic. Uh, so I'll look at the environmental factors. The environmental factors basically it's an indicator that measure both the physical and biological environment in which disease occur. It's the exposure of a population can adversely affect the quality of life and cause mortality and morbidity. Now, this indicator basically looks at the exposure rates, like at least the rate at which an individual is exposed to air pollution. It also looks at the intake of heavy metals in food, in water, in water consumption, and it also looks at a chronic disease in your environment. How does this disease is being transmitted from your environment to and how it affects your health. So, when the next slide, because of time, we would like to move to the conclusion. The health of an individual is not to be taken lightly, but with equity and access to health care. The major challenge of national health account is measuring health accuracy. It is crucial to track the health of a population accurately, particularly with the vulnerable section exposed. Then there's need for drastic actions, interventions to support the health status and quality of life of an individual to prevent the occurrence of disease is essential.